Hi everyone, welcome to this video. I'm Dr. Uri Burstyn and this is Mr. Pirate, and I'm making this video after being off of YouTube for a few months, and I just wanted to tell you guys a little bit about what's been going on in the meantime and a little bit of why I haven't been making videos lately. It's been kind of a challenging few months for us. I'm making this video in January of 2022. And at the end of September, beginning of October, Mr. Pirate got quite sick, which took up a lot of my time and emotional energy. Those of you who follow my channel know that Mr. Pirate has been my little buddy throughout most of my adult life. I have a whole video called The Story of Mr. Pirate that's going to be linked in the video description below that I encourage you to check it out. It talks about how I'm basically his mother. I raised him from being a tiny little kitten, how he's been with me throughout my whole life. So he's my little buddy, he's my little friend, and I love him very, very much. And this summer, I made a video series on the 3 most common old age cat diseases. So inflammatory bowel disease, hyperthyroidism, and kidney disease. And in those videos, I mentioned in the video on IBD that Pirate's been living with inflammatory bowel disease for about a decade. Well, this fall, he developed the other 2. So now he's living with all 3. As I mentioned in the IBD video, Pirate has a food-controlled form of inflammatory bowel disease. This is basically an allergy to a protein, and he's been doing really well on a limited protein diet from Royal Canin up until this September. Now, I've also been tracking his kidney values over the last couple of years. He's had some kidney issues for a long, long time, but they've always been well below the threshold of clinical concern. Also, over the last 6 months, I've noticed that his thyroid levels have been creeping up, and frankly speaking, this really illustrates the importance of doing regular blood work on your senior cat. You know, we always talk about how it's important to do regular annual blood checks on cats. Well, I've been doing a blood test on Pirate 2 or 3 times a year for the last 2 years, and it's really paid off because I was able to monitor trends in his blood values. Even though they were within normal limits, I could see that they were trending up, and I knew I had to keep an eye on them. And also, of course, early detection when things did go wrong. So what happened this September was that because of COVID-induced supply line shortages, Royal Canin was no longer able to supply the limited protein diet that Pirate was dependent on. And I'm pretty sure this caused a crisis all across North America. I know I had many clients whose pets were dependent on special diets, who had inflammatory bowel disease or other food sensitivities, scrambling to find alternate foods for their pets. It was a big crisis, and frankly speaking, I probably should have made a video about it at the time, except I was too busy actually dealing with the crisis. And of course, not every food will be right for every IBD patient, so there's always a little bit of trial and error in finding the right food to control these symptoms if it is indeed a food responsive inflammatory bowel disease. Again, it's all covered in the video I made this summer. So as I was trying a couple different foods with Pirate, they didn't work. He started developing severe diarrhea and vomiting, got dehydrated. One day I looked at him and he had like 5 bouts of diarrhea that morning and looked dehydrated. And I was like, dude, you're coming to the hospital with me today. So I came going to work, put him on IV fluids. And actually, I should have said this earlier in the video, but I'm going to talk a little bit about Mr. Pirate's problems, but I'm also going to, in the second half of the video, talk to you about the lessons I learned from personally managing his health conditions. So I got Pirate into the hospital on IV fluids, did some blood and urine testing, and what we found was that his thyroid level was sort of top of normal, but then I did some secondary tests, the free T4 that I mentioned in the hyperthyroidism video. And again, all of these videos are in the description below. And if you have a cat, you should definitely watch all 3 of them, because at some point in your life, you're probably going to be dealing with 1 or more of these. So I did a free T4, and sure enough, Pirate has become hyperthyroid, sort of in the background without showing any symptoms. And then once we treated that, it unmasked kidney disease, which was exacerbated by the urinary tract infection that he got from uncontrolled inflammatory bowel disease because of the food shortage. And it's all basically compounded to put him into a crisis. It was a rough couple weeks, but at the end of it, I still have a 19-year-old cat who looks shiny and plump and has a reasonably good quality of life. He's also got a little bit of arthritis in his elbows. So, you know, he's a creaky old man, but clinically, you know, there's many 12-year-old cats that wish they looked this good. But it was a lot of work. So, and it honestly, in all my time as a veterinarian, I don't know if I've ever encountered a cat who had all 3 old age diseases at the same time. So, you know, lucky me, yay. Lucky Pirate.
but it's quite rare to get more than one, and to get all three is just terrible luck. On the other hand, you could also argue that Pirate's very lucky to have lived long enough to gotten all three and still be doing pretty well. So he's got all three old age cat diseases, which are being currently managed by yours truly. But that's certainly eaten up a lot of my time over the last few months and a lot of energy. I just want to take a quick moment to give a shout out to a small pet food company called Rain Pet Nutrition. This video is in no way sponsored by them, but I do use their food a lot in my clinical practice. And the reason I want to give them a shout out is that when I was looking for new protein diets to feed Mr. Pirate, I ran into some trouble because, of course, kidney food is one of the three pillars of managing kidney disease, so food appropriate for the stage of kidney disease. And of course, Pirate cannot have any of the regular renal diets available on the market because of his inflammatory bowel disease. So I went looking for food that is both meets the criteria of a de novo protein diet suitable for managing his IBD, and one that is also appropriate for early to middle stage kidney disease. What a lot of people don't know is that all of the major pet food companies, so Royal Canin, Hills, and Purina, do have a veterinary nutritionist department and give out free nutrition consults to veterinarians on behalf of their clients. And these are the three companies that actually do research in pet nutrition and are really like where all information we know about pet food comes from. So they have these like nutritionist departments, and they offer tech support to vets to like help with dietary management. So I wrote to all of them presenting this case and asking for advice on which food to feed. And I also included Rain, which is not a big company, but I certainly work a lot with them in this email. And of all the nutritionists who wrote back to me with advice, the nutritionist from Rain was just awesome. Like, they really went above and beyond. Instead of just copying and pasting an email to me, they actually really had a conversation with me and really obviously put some thought into which diet would be most appropriate for this little guy. And they made some recommendations, which I tried, and one of them worked. So they were really instrumental in helping me manage Pirate's inflammatory bowel disease and kidney disease at the same time. So just a big shout out to the nutritionists at Rain. I will certainly be relying on their advice in the future, and I just really appreciate the amount of support they gave me picking out the right food for this complex little medical case. So what did I learn from all this? Well, I learned that there's certain insights that you get from actually personally managing an illness that no amount of medical training can prepare you for. Now, I always say that experience should not matter in an evidence-based profession like medicine. I usually say this because I get really frustrated with older veterinarians and older human physicians who basically use experience as an excuse not to stay up to date on the latest evidence and to do out-of-date treatments and diagnostics just because they're comfortable with them and too lazy or too not give a damn anymore to learn new techniques. So I often use it in a derogatory sense, but there's certainly a certain amount of wisdom that comes from personal experience in terms of not how you manage disease, but the practicalities of doing it at home and dealing with it day to day that I would love to share with you guys. It has been tough, but I just want to say that I was going through all these issues of labor shortages and supply chain disruptions and health problems with my little buddy. I'm just always very cognizant of the fact that we live in a golden time in a golden country, all of us who are in the West, and that all of our problems are really just relative. So one thing that this experience has given me is really just a bit of perspective on how good life really is and how, despite all of its challenges and disruptions, we really need to practice gratitude and just really appreciate all the good things about the world we live in. But that little bit of philosophy aside, I think I might actually make a whole video on how to tell how much and how often to give fluids to your cat. I have a video on how to give subcutaneous fluids in a cat. Again, link in the description below. But there's actually no evidence-based recommendations on how much and how often to do it. We know that doing it is very important. It's one of the three pillars of managing chronic kidney disease. But exactly how much to give and how often to give is really, it's totally all over the place. And so I think I got some insights into that, which I'll share with you in an upcoming video. All I can say is that it can be tailored to the patient's hydration level. But yeah, so just things around giving fluids, managing diet, managing medications. There's just a lot of nuance that I think you learn. And I definitely not suggesting, I would never wish it on any doctor, whether they're an animal doctor or a human doctor, that they have to deal personally with disease. But certainly, I'd say it makes you a better doctor, or it makes you better able to support a patient dealing with a health condition if you actually had to treat it in your family members or yourself. And good Lord, Pirate, what's happening here? We're going for belly rubs? I think we're going for belly rubs. Yes, we are. So it was a very good learning experience. And again, this is an experience that I'll be able to take and translate to the care I offer my patients, to the information I offer you guys online or on YouTube. But it's definitely been rough, and I'm very worried about my little guy. But so far, so good. And I just hope his story and our story illustrates the incredible importance of doing regular blood work, monitoring, regular visits and checkups for your pets, especially your cats as they get older, because they do get all these old age diseases. The fact that I was monitoring Pirate's thyroid trends allowed me to guess which tests to do and to identify his thyroid disease. You want to come down? Okay, you can come down. Pirate is doing a little snack run. He'll be back for the end of this video. One of the important things I've learned to monitor is appetite in cats. And again, there's a lot of wisdom around managing constipation and hydration that I would love to share with you guys in a discrete video somewhere down the road. The monitoring of trends in his blood work allowed me to make an early diagnosis and initiate effective treatment without waiting too long. And now we're doing blood tests every 2 to 3 weeks to monitor his response to medication and fine-tuning his fluids based on his hydration status, fine-tuning his thyroid medication based on his thyroid levels. And I think this is what's allowing me to really optimize his health and have a reasonably, a cat who doesn't know he's sick, even though he's got 3 serious age-related conditions. You as pet owners can really help veterinarians do this, because I know that in my daily practice, I often don't do the level of monitoring I really, in my gut, feel would be appropriate and that I know gets better results, because of concerns about the pressure I get from clients about the costs and the hassle of having a cat come back, say, for blood work every 3 weeks. And every veterinarian has this experience where they get told by clients like, oh, pretty often, how many times do you have to do this blood work? And, the real answer is as often as it takes, and probably then some. But that's a very unsatisfying answer, and it's a very stressful conversation to have with a client. So most vets just default to doing 1 or 2 blood tests and then hoping everything works out, or maybe not even that. And unfortunately, this isn't really good medicine. And you as a client, if you do have cost concerns or if you have practical concerns, you should always bring them up. But you should also be careful not to pressure your doctor to not do medicine. And I guess I can assure you guys that if your pet has a chronic health condition, then you can't do too many follow-up blood tests. And it also benefits you guys. The thing is, if you have cost concerns, saving money on monitoring tests is the last thing you should be doing. 10 blood tests at 3-week intervals, that's like 30 weeks of testing. That costs less than half of 1 night in ICU, or probably less than a third of treating a cat in uremic crisis when he used to be in IV fluids for a couple of days. So in effect, close monitoring, while I appreciate, it's stressful bringing the cat to the vet and shelling out, $120, $150 each time, it actually will save you thousands, if not tens of thousands of dollars over the next couple of years of your cat's life. Not to mention make your cat's life better. So just the important of monitoring tests in geriatric patients, as well as post-treatment monitoring when you actually have a diagnosis of a chronic health condition. Those are so important, and it's so underdone in my profession, often because of pressure from clients. So that's, I think, a really important thing to be aware of as a cat parent or a dog parent. And you will actually save a ton of money. I know that's a big concern for a lot of people. You'll save so much money if you just do regular monitoring rather than just treat the horrible crisis when it finally erupts. It's ridiculous. I've done the math a couple times, and I'm pretty sure over the 3 clinics that I run, I'm pretty sure we save people our clients in total over $100,000 per year by basically being proactive in monitoring and diagnosis, and by this means keeping our patients out of the hospital and keeping them out of emergency rooms. At least $100,000 a year over my client base, which is, pretty awesome, but only if people follow my directions. If people ignore my directions, then they don't get to benefit from that. So lots of insights. That's the situation today. Thank you very much for watching and sticking with me. I'm going to bring Pirate back here in a second. We're going to say goodbye to you guys and hopefully crank out a few more videos over the coming months. If you know a veterinarian looking for work, get him to hit me up, because if I could hire 1 or 2 more vets, I would, and then I would make a lot more YouTube videos instead of being in the clinic doing surgery 20 hours a week. All right, everyone, Mr. Pirate's back, and this is the moment you've all been waiting for. As I'm sure you know, he is the world's most famous shoulder cat. So to say goodbye to you, we're going to invite him onto my shoulder and muffle the mic. Come on, sir. Yeah. There we go. The shoulder cat rides again, and hopefully for many more years. Again, thank you very much for watching. Please forgive the muffled mic, and please feel free to send some good wishes and positive vibes to Mr. Pirate. But you know, his personal physician's on the job. You know, take really good care of this little guy, and I look forward to making many more videos with him for you guys in the future. Thanks for watching. Have a good day.